Now we'll go over how to use the extension cone paralleling technique. So these are XCP holders. The easiest one to assemble usually is the anterior one, which is in blue. And so you have the bite block here, the metal rod, and the ring. What you want to do, probably the easiest way, is to first assemble the bite block and the metal rod. And then when that's put together, you want it to look like a chair formation, like this, or some people call it steps, like this. And then you put the ring on in such a way that when you look through the ring, you can see the bite block in the middle. And we have a couple different sensors that are being used nowadays. What I'm going to put in now is a PSP plate. It's wrapped. It's photostimulable phosphor plate. Put it in like this, and then you look through the ring and you can see the plate there. And then so for the anterior teeth, you would put this in like this and expose the x-ray this way, and then change out the film or sensor and get a new one and do the canine here, center it on the canine, have the canine tooth biting right in the middle of that bite block area here. Same thing for this one. For the lower teeth, you would just flip this facing the lower teeth, do the middle, do the canine, and the other canine. Common sort of misconfigurations with this instrument is, well, the more basic one is to put the PSP plate correctly. So you put the black side to the ring always. If you put it this way, you're going to end up with like a metal water with a watermark, sort of a circle on the image. It's not going to look pretty. And this is a regular film. So you would, with the film, you would put the solid white side to the ring. And then the most common sort of misconfiguration when this gets put together, sometimes people put the bite block this way, and I call it looking like a Big Dipper. So you don't want the Big Dipper view, because then you look through here, obviously you don't see the bite block. Now we'll go over how to use the yellow or posterior XCP film holder. And so what you want to do is take the bite block and the metal rod, put the prongs in here, and then put the ring on in such a way that you can see down the middle of it and see the bite block. This is probably the more challenging XCP film holder to put together compared to the anterior one or the bite wing, because when you move from the left to the right side, you'd have to change the configuration. So let's use it first like this in this configuration. So I'll take a PSP sensor here, and then so this would work for the patient's upper right, like this. The x-ray would get exposed from here. And now you can use this same configuration for the lower left, like this. So basically it's an inverse relationship. You can use it upper right, lower left, or then when you want to change this XCP, probably the easiest way to do it is to hold everything together like this and then flip the bite block up, and with the ring turn it 180 or like a cartwheel this way, and then you look through here and you're seeing the sensor again. I find this new people using the XCP, this is the most sort of difficult part of manipulating the yellow one, is to change it from side to side often. So this would be upper left, lower right. The common very common misconfiguration is to put this together like this. It almost seems like it matches, but it obviously doesn't. You look through here, you don't see the sensor in the middle, and you can oftentimes take an x-ray this way and almost capture the teeth, but it will most likely do make a cone cut, so that's not a good configuration. And another thing to mention is these posterior teeth are usually done in the horizontal position like this. Unlike the blue anterior one, you do it usually vertically. And the bite wing, the red one, most of the time it's horizontal, but sometimes you have a vertical attachment, a need for a vertical bite wing. All right.
Okay, I'm going to show you a few techniques that you can use when you're doing the anterior PAs of a narrow mouth. If you have the perfect ideal patient, you usually don't run into any problems. It's when you have these difficult patients, whether they're narrow or shallow palate or whatever, that's where you have to do a little bit more creative x-raying, as I say. There's different pieces that you may want to use. Some offices, again, always use the ring instruments. They're great. Or some offices use the bisecting angle technique. I think I'll start with the ring and show you how to do a few anteriors. Now, the size film is a size 2, and many times it's too large for a very, very narrow mouth like this. And why it doesn't fit, you cannot get it from side to side behind those front teeth because it is way, way too wide. So there's two options. Switch to a narrow size 1 film, and if by chance your office doesn't have them, the other option that you can do is place the very edge of this film farther back into the mouth so that it actually fits between the dental arch. So if you notice, I'm not directly behind the teeth. I've got the film way back by the molars. Now, before she closes, what I'm going to do is roll the whole unit upward and then have her gently close and bite. Close. And your goal is to get the lower teeth right up onto the bite block. What helps sometimes is if you use a cotton roll. Right now, I'm going to take that out. She really has to close to reach this bite block. And to make it easier on the patient, if you actually put a cotton roll on the upper part of the bite block, she will be able to secure the whole unit in her mouth a little bit more easier. Let me know. So again, I'm going to put it way back there to fit, roll it up, and then directly put the cotton roll up right under the front teeth, and then have her close and bite. Bite. Okay, open. I think she's so narrow. Bite. Sometimes you have to readjust it a few times to make it work. Slide this in, and then you're going to actually put your cone in and get the perfect picture. When I say roll the bar up before she bites, it helps eliminate, if you look over here, a lot of foreshortening. I'll show you what happens to create that with this piece here. When you put it in, if I did not roll it up, gently close, you can see now the whole unit is actually tipped downward, and by having an upward direction of the x-ray cone, you're really coming from bottom up, and it's actually projecting that very, very short image. So rolling it up before she bites will eliminate this problem here. Ideally on her, it would have been great to have the size 1 film, and I'm going to show you how much easier it is to place it. First of all, the bottom edge, you can actually place a little bit closer to the teeth behind them. So she's still so narrow, I'm still going to have to go quite a ways back. But before she bites, roll it up and then close. You see how that actually works a little better than just closing down. A good idea too is to actually explain to the patient what you want them to do before you put it in. So I would say to her, what my goal is for you is to gently bite on this, okay? And then they know what to expect. Another error people make sometimes is when they do place it here, they slide it up and they hold it up. So now when the patient tries to close, it's real, it's difficult. Open. It's jabbing so much down below, you're not allowing it to actually find its way. So let go of the bar as she's closing, and it'll kind of ease into place. Another option that you can use besides the ring instruments for the anterior teeth is the bisecting angle. It's a different holder. There's different varieties actually, depending what you have. You can see that one has a little curved edge. This one is straight, but both of them work very well. I'm going to show you this one because this is a great one to use because it actually makes it a little easier for you in getting the correct vertical tube angle. You've got to remember now that the vertical tube angle, the up and down, is going to cause your elongation or foreshortening of your images, and so you really have to make sure that's correct. This instrument here really helps guide your cone so that you are getting the correct angle. And so what I'm going to do is we're going to do the upper ones to start with, and we're going to have her gently bite down right here. And if you notice the slant of the bottom edge that she's biting on, the little bite tap, you're going to actually vertically set your tube so that's in the same line as this piece is actually directed. So we'll show you how that works. I'm going to just place this in. Now the bottom edge needs to go in enough so that it fits between her lower arch. You don't want it out here like this. You want to seat it deep enough so that it fits. What I'm going to have you do is gently close. If you notice now, her anterior front teeth are resting just where you need it. I'm going to turn your head to the side for a minute. If you can look at the direction that this piece is actually sitting, this is the guide that you're going to use to set your vertical tube angle, which is this way. And if you can see, it's really turn your head there. So you can see the direction is kind of slanting at about 30 degree. I'm actually going to start angling this so that if I were to continue this line in the direction that this is flowing, so you can see this would be correct, this would not. And what that does is it actually is positioning your vertical tube angle to the position of the film in the mouth. So right now the film is like so, and so the X-ray beam is being directed almost at a right angle to the film placement. So another thing you don't want to do is cone cut your image, meaning not align the circle with where the position of the film is in the mouth. So you don't want to be too high or too low. I suggest the bottom edge of the cone here is actually down far enough so that it's including the base of this piece right here. So this would be incorrect. This is more correct. Now some people have a shallow arch on top, so the whole film itself, open, is actually may be sitting like so instead of like this. So why don't you just pretend it's like that. So if it were to be like this, now you can see that the vertical tube angle has to even be increased more to accommodate this type of a mouth. We've had a lot of questions about patients that have tori and how to x-ray and get around these tori and get good films. Well, actually, what is a tori? 5 to 40% patients have them. They aren't anything to be concerned about. They're just extra bone that some people develop in their mouth. A lot of people don't even know they have them. We do when we have to x-ray them though. If you look over here, you can see these little large radiolucent areas, or I should say radiopaque areas, on our films. And these are actually that extra bony growth that is actually what a tori is, and it's projected on your film as a little bit more dense area. So you won't be able to eliminate this at all on your films when you're taking them, but you have to be able to get the x-ray in there to get the images of the teeth that you need. And this can be a problem sometimes, especially when those tori are very, very large. If you want to look inside the mouth, the bony growths that I'm talking about are on the lower right behind the canines usually, and there are two large bumps there that can cause a problem when putting the x-ray into the mouth. So we'll show you some techniques to get around it. Usually what you want to do is place the bottom edge of the film behind the tori and not on them. So this piece here is going to really be set a little bit farther back depending on the size of those large growths. And once you get behind them, raise the bar up and then have them gently bite down. And this won't cause any pain or anything, but they still you'll still be able to get the anterior teeth very nicely by just putting it behind them instead of on top of them. It makes it a lot more comfortable on the patient's mouth. Notice I did have a size 1 film. He is a little narrower, and depending on the shape of the dental arch, you can either use a size 1 or a size 2. The offices that don't use the ring instruments, but they do the bisecting angle, can actually get some nice films with tori also. So what I did is I'm using this type with the slant of the bite block, where it places the film more of a slant instead of straight. It doesn't matter which type you have, they both work really nice. So again, the bottom edge is going to go behind those two bumps, so you're going to put it really far back, raise it up before he bites down together. You can see it, this actual piece works so nice because the bite block is actually thicker, and it takes the place of a cotton roll actually, that you can eliminate that step. I'm going to turn them to the side a little bit. By doing so, this film right now is placed on an angle about so. If we don't have our ring and bar to guide our vertical tube angle, we have to now set our own. So how much do we angle the tube in the up and down motion so we do not get elongation or foreshortening on those teeth? If you actually follow this actual bite block here with your x-ray cone, you'll be able to really get the correct tube angle, because this is set in the relationship of the angle of the film that's in the mouth right now. So what I'm going to do is bring the cone, line up the top edge of the cone so it's running in the same line that this actual bite block is running. So I think it's just about like so, and that's about how much vertical tube angle I'm actually going to need. Just make sure the top edge is covering, a little bit above the bottom edge of this, so you're not going to cone cut the occlusal surface of the teeth. If this has been in the mouth on a different angle, let's just say it was like this. Okay, close. Now you can see that this angle is even more severe. So in that case, you're going to have to increase bottom up your vertical tube angle to compensate for the film being a little bit more flatter in the mouth too. So you will set it more in this angle versus the first one that I showed. Had you changed this or not changed it accordingly to the slant of this, will cause the wrong vertical tube angle and will cause an elongated or foreshortened image. So always follow the position of this with your tube and you shouldn't have any problem. Sometimes the premolar PAs also create a problem when there's tori in the mouth. I'm going to show you the two techniques with using first the bisecting angle. Again, what you want to do is put the film itself not on top of the tori so that the film is next to the teeth. You're going to move it away so that the film sits directly between the two tori. There should be a space between the two that allows you to actually lower the x-ray film in. So it's going to be right in between the two. Have the patient gently close, and as they close, the film is going to adjust accordingly to how it can fit. Because the film now is slanting a little bit away from you, you want to make sure that your vertical tube angle is slanting upward to accommodate the slant of the film, which is going under the tongue more than this way. So because it's slanted, you're going to actually set your vertical tube angle more in an upward placement when you're x-raying this premolar. Just make sure the top edge of the film or the top edge of the cone is covering the top edge of the snap array, because your film itself is right below the snap array and not above. So you can see this is incorrect. this is correct. The side of the cone should actually be so that it just skims the corner of the snap array. And that's so that you do not miss the actual image here or here and getting cone cut. You want to make sure that the whole x-ray plate is right within the circle. So this would be correct in this position like that. If you're using the rings for the premolars, again, I'm going to just retract the cheek a little bit to accommodate this piece. Make sure that this edge of this film is right between the two tori. You can feel them, they're large ones. So I retract the cheek to accommodate this piece. It makes it a lot easier on the patient. And then so you can just kind of get that in there first, holding the cheek out. And then put your chin down just a little bit so they can see. And you don't want this on the tori, right in between the two. Once you get it placed there, allow them to close, let go of the bar so that it works its way down and he can actually close, right onto the bite block. Slide your ring in, and because you do have the ring system and the bar, which makes your vertical tube angle easy to set, you follow the bar and put the cone in the same direction the bar is directed, and you should have a perfect film. I hope this has been beneficial to you in helping you take your x-rays when there are problems such as tori in a patient's mouth.
The number one thing you want to remember for mounting is that the convex dot is always out, so bubble out. And you can just start by laying out all your film, make sure the bubble's forward. So slip in your name tag at the top of your mounting. Now the first thing I start off with is your anterior, and this is for paralleling. Bisecting would only have 3 slots. So you'd start with your anterior teeth first, and the centrals are fairly big, so you could always tell what's going to be your centrals. If I can get it up. And then dot is facing out, and you just slip it in like so. Now you always want to make sure that you'll know too that the dot is on the incisal edge for your anteriors and for your periapical. So that helps. Next thing is your canine shots. And the difference for canines that you can tell from the top and the bottom is you look for the sinus. The sinuses are going to be your biggest clue for maxillary teeth. Now for your mandibular, you want to with the mandibular, some of the anatomical landmarks would be the mental foramen. So that's kind of a big indicator to help with your canine shot. And then next, I go to bite wings. And the good thing about bite wings is you want to make sure that it has a smile line. So it looks like a smile. And you can tell that this is your premolar shot because it's got the distal of the canine. So that just goes up here. And with this one especially, you can see like how the third molar is like tipped, so it looks like a smile, so that you know that it goes here. And if you have them side by side, you can kind of compare them too to make sure which one's your premolar shot and which one's your molar shot. And just slip them in. And next we come to periapical. This is probably the trickiest part. So I like to separate mine, so making sure that the dot's always out and the dot's on the incisal edge. So that's first things first. Next thing I like to do is the sinuses. You can tell which one are maxillary. So we have a maxillary one here, and a maxillary one here, and a maxillary one here, and a maxillary one here. A good thing about periapical pictures as well is if you compare them, you want to make sure that both teeth beside each other match up. So with this one especially, it gives you a little hint. The third molar is coming in, so we know that that would go on the left side of the mount. You can look for like little clues like that, or like with chipped teeth or erupting teeth. And then you know, it's kind of like a puzzle. You start eliminating pieces and pieces match up and go together. And then for the bottom, we have the smile line again. You want to look for the curvature of the roots. And you're going to know that these are the last because you can see the distal of the third molar. So we know that that goes in there. And last but not least, we have our 2 premolar shots. And it's as easy as that. And then you just want to take a look and make sure that everything matches up before you hand it in.